So that's the first thing is just start somewhere and start working. If you don't know where to start, just put your hand on the person and start working. And then you'll see after a few minutes, it gets easier. And then you find your way. Your fingers start to find the places, intuitively. So listen to your intuition, and make sure that your intention is just one of purity, one of goodness, one of, like medical practitioners take an oath, and the oath is, thou shalt do no harm. So as long as you stick to those guidelines, even if you do the session totally wrong, it will be okay because your intentions were good. And any level of touch has healing. So that means even the lightest touch has healing properties. Energy work, Reiki, golden light, all those kind of things are all fantastic in their own way. So if you don't know what to do, just make sure your intention is good. Okay, so you've worked the intercostals, the diaphragm, the abdominals, the pubic symphysis, and now you've changed position and you're going to work on the iliotibial band and tensor fascia latta and the head of the iliac crest, the head of the femur and the iliac crest. And you get to the point where you're working the IT band, you're going down towards the knee. It's extremely uncomfortable for the person. And what do? Well, you have to be patient. You have to stay with it. You have to be focused. And you have to follow the line. You have to follow the midline all the way to the end. So the client has to be focused. They have to be breathing. They have to be present. And they have to be, initiated in their response. So a lot of times the iliotibial band is in the wrong position, or it's moved over, moved lateral, or medial, or it's somewhere it's not supposed to be. And when you start to reset that, it can be a little tricky, a little scary for the person because they've never felt that before. And so you just have to comfort them and encourage them and remind them to keep breathing. Talk to them, distract them, talk about things that aren't related to the session. Sometimes that works. But the main thing is for the therapist, you just have to be totally locked in on what you're doing, because the IT band is a unique thing in that it's on the side, so it does abduction of the leg, but it's also interconnected fascially with anteriorly with the abdominals and posteriorly with the thoracolumbar aponeurosis. So it's kind of a middle point between two big pieces of fascia.